let's bring you now to the story that we are tracking for you this afternoon. The South African Emergency Personnel Union has condemned the recent attacks on emergency services personnel. This comes after family members of a patient allegedly attacked two paramedics dispatched to attend to a call last Saturday at Kabukweni in Mpumalanga. Now, the union representing paramedics is calling on the provincial health departments to provide protection to first responders who face danger while trying to save lives. Now, last week, two medics responded to a call only to be met by an angry family member who accused the medics of taking too long to assist patients. The two medics ran for their lives, leaving the ambulance they arrived in behind and jumped into a taxi to report the matter. According to the union, the Mpumalanga incident is not the first attack meted out on paramedics and has described the act as shocking. The union has urged community members to refrain from threatening and attacking emergency service personnel. All right, on this, we are now joined on the line by National Department of Health spokesperson Foster Mohale. Foster, a very good afternoon to you. So this incident, as we've just heard in that story, is not the first time, and as the South African Emergency Personnel Union says, first responders need to be better protected. I mean, as you give us, firstly, your reaction, Foster, to this particular incident, perhaps give us a sense of how widespread these attacks are.
Good afternoon to you and good afternoon to your viewers at home, and thanks for this opportunity. As well as the Department of Health, we also want to join the union to condemn this unfortunate incident targeting our emergency medical personnel. We are deeply concerned that our EMS personnel or the teams have been targeted by violent criminals. And we say the safety of EMS personnel and all healthcare workers remain our priority, and we will continue to provide necessary assistance to the affected personnel.
Now, I mean, as you've heard in that particular incident, it wasn't a crime necessarily. It was a family member who was frustrated, obviously. So it is a two-pronged problem where you have criminality element, but also you have, potentially a family member attacking, somebody that is there to help them. I mean, how much attention is this problem getting, from the department firstly? And how, for instance, are you assisting the emergency personnel from a safety and security perspective? And I would imagine psychosocial support too.
No, definitely. Whether it was our healthcare, our emergency medical personnel were caught in the crossfire between the family dispute, that we condemn it because that's not supposed to target them. If the family members, they want to fight among themselves, they need to leave our EMS alone so that they are able to provide or perform their duties without any feeling of threat. Therefore, there are different areas in the country which are categorized as high-level crime area, low-level crime areas as per the FAP. So we work closely with the law enforcement agencies, foreign police service, community policing forums in different areas, including the community structures like traditional leaders, the councillors, and so forth. But we say it should be our collective responsibility as a society to create an enabling environment for our emergency personnel to be able to perform their duty of life saving. So if they're not able to perform their duties, it means someone is going to lose lives, which is avoidable.
And what do you say to those calls then by the union, to actually protect some of these members by providing security? I mean, I know that you are working with SABC on this matter, but would you then, take it up within the department itself to create that protection?
Yeah, no, as I indicated earlier on, that the areas that are known as high crime areas, which are categorized by the SABC, there we don't just send our crew alone. We always ensure that they are escorted by other security companies or sovereign police service or community policing forum, so that they are being ones to ensure that they're able to perform their duties without also becoming the victims of crime. So, but other areas that are not known that as a low crime areas, then we just dispatch them to go and perform their duties because we don't have any information which suggests that they might be victims of crime. But as you know that crime is unpredictable, so you cannot be able to see with your naked eyes that who's a criminal, who's not. So hence we want to call upon all the sectors of society to join hands with government in order to ensure that they protect our EMS members to be able to perform their duties without becoming the victims of a crime.
And when we look at this particular role, Foster, in terms of the emergency services personnel, just talk to us about how well capacitated are you as the healthcare fraternity? Because, of course, we know that, the Department of Health and the healthcare fraternity has come under heavy criticism, particularly on just a resourcing perspective.
Yeah, no, in terms of the resources, we do have the resources to save lives. So the role of the EMS personnel is to save lives. In terms of the resources to save lives, we do have, but in terms of us having the bulletproof and the guns to protect ourselves, there is not our area of expertise. That's why we always ensure that we work with the structures or different stakeholders within the community. And we cannot have the bulletproofs on our ambulances because our ambulances are there to save lives instead of carrying money or any other valuable items. Hence, we say we do everything possible to ensure that our EMS members and also other healthcare workers, because not only EMS members who are victims of crimes, but also our doctors, our nurses in the health facilities, they are also targeted for criminal activities. So hence we say, as government alone, we will not win this fight, but we need the other stakeholders within the communities, because some of these criminals, they are known within the communities. So members of the communities we need to join hands with government and report these criminals which are operating within their communities, either anonymously or openly, so that the law enforcement agencies are able to deal with these criminal activities.
All right, Foster, let's leave it there for now. Thank you so much for your time. Of course, that was the Department of Health spokesperson, Foster Mohale.